Hi, everyone. Welcome to our meeting for our local leadership board advocacy chairs. We're really excited to bring you our very first nationwide training. Thank you for being our guinea pigs. My name is Anna Hyde. I'm the Vice President of Advocacy for the Foundation, and I'm going to over for a second to Julie Eller, who's going to give a couple of housekeeping notes. She's our grassroots manager. Many of you probably already know her, and if you don't, you should, because she's phenomenal. And she's just a few weeks into this role, so I'll come in a couple of minutes and talk about some of the other staffing changes that we've had.
Great. Hi, everybody. Thanks so much for having us on here today. We're really excited to share with you about our advocacy committee and our chair positions and everything like that. Throughout the briefing, sorry about that. If you have any questions, feel free to type them in the Q&A section of the PowerPoint. It's right in the bottom of the WebEx, and I just typed them to everyone saying, hey, if you have any questions, please feel free to type them here. We'll collect them, and at the end, we'll moderate those with our other staff members on the call, and then we'll get as many of them answered as quickly as possible. And with that, I'm going to turn it back to Anna Hyde.
You may or may not know that we've been through a number of staffing changes as we've worked to sort of reshape our advocacy program. So I took on the role of Vice President just a few months ago, and some of the other changes here in the DC office. You've now met Julie, who's our grassroots manager. We have a new Director of Federal Affairs, Vincent Basilio. And on the state side, we have promoted 2 people from our state program up. Michelle Guadalupe is now our Director of State Legislative Affairs, and Ben Chandoke, who's based in the Boston office, is our State Policy Director, which is actually a new position. And then making up our advocacy leadership team, sort of rounding things out, these are the folks that you probably know and work with the most. We have Stephen Schultz, who's based in the Sacramento office. We have Claudia Stewart, based in the Richmond, Virginia office. Pam Fields, who's in Cincinnati. And then we have a brand new staffer who hasn't actually started yet. She starts on Monday. Her name is Courtney Kowaleski, and she will be near the city office. So with that, here's the little chart there, and you have these slides. This is an advocacy leadership team map, so you can see what the territory is for each of those folks that I just mentioned. And we can send out contact information afterwards if you don't already have it. I'm going to round out my little part here by saying that really the goal of this call is to level set for both ours and staff about really what the role is of the advocacy chairs on the local leadership boards, who it is that you're going to be working with in the markets. You already have really good relationships with your advocacy staff and other mission market staff, but we're just going to questions that you have. I think we're going to go through these slides relatively quickly, so we really want this to be more dialogue-based and have an opportunity to answer questions while a good chunk of us are on this call to do that. And then I'll just end my part by saying that we always have an open door. We're always available to answer questions. So with that, I am going to tag in Stephen Schultz, who's going to talk about integrating advocacy into local leadership board meetings.
Okay, thank you very much. As Anna said, I'm based in Sacramento. I have most of the Pacific states to Northwest states, as you saw on that previous map. I'm excited to speak to you about integrating advocacy into your local leadership board meetings, and a little bit about leveling up and finding great people for your advocacy committees. So if you want to go to the next slide. So one responsibility that a local leadership board advocacy chair has is reporting back to your board meetings, your board members, about what's going on an advocacy level. And I think what we found is one of the best ways to be able to do that is with some sort of advocacy report. It allows you as the chair to be able to have something, a one-pager most likely, that you can provide them in the packet with any other information that's going out to the members of the board about anything else that they could take home, read at their own leisure, and any action items on it. So the advocacy staff, your community engagement director, any other local staff, your executive director, and your development director can work together on developing a report weeks prior to a board meeting with obviously the advocacy staff member playing a huge part in developing it, and then utilizing all staff members and chair to kind of come up with the final product. Really should include top-line accomplishments. So if there's been a bill signed in that state, that should be provided in the report. An update on national goal progress. So this is a good place to put how you're doing on advocate recruitment. I always like to put boards who are signed up as advocates, so it allows you to put how your board is percentage-wise on that goal. The area is also a good spot to put doing as far as federal legislation, if there's any co-sponsors on key legislation on any federal bills that we're supportive of. Next, status of state legislation. It's good to put a detailed couple-sentence blurb on any state legislation going on at that time and where it's at in the process. If it's introduced, if it's passed one of the houses, it's good to have a good idea of what's going on. Grassroots progress, another place where you're able to put advocate recruitment or, like I said, the board recruitment as well as advocates. It's good for them to be able to receive these emails, like the one we actually sent out this week regarding the Senate health care bill. So they don't have to be the most active in advocacy, but it's good for them to receive those emails. Next, the upcoming advocacy events. So it's a good spot to put your advocacy summit, your local, state lobby day, or any upcoming trainings. And lastly, action items. Like I said, we want board members who are actively engaged and have an interest in the Arthritis Foundation to want to leave that board meeting wanting to take action, whether that's scheduling a meeting with their legislator during office recess, emailing them or their staff about asking them to co-sponsor a bill, or any other type of action item that's appropriate for that type of year. So, like I said, the report in itself is a fantastic resource to be able to provide that detailed information to a board. And like I said, as an advocacy chair, don't feel like you're having to come up with the information yourself. This is a kind of a team effort that is going to happen state by state or market by market, but it's in that we're kind of that would be ideal to have. Makes the advocacy chair, the staff's lives a lot easier going forward. And the second segment that I'll be talking about is bubbling up advocacy committee members. So deviating from to your board, second responsibility as an advocacy chair for most state in most situations would be chairing an advocacy committee. And one of the ways have a functioning and effective committee that you'd be the chair of is finding good people to sit on it and to participate in it. So how do you do that? Where do you find those types of people, or in situations as a staff person, a community engagement director, a development director, an executive director, where do you find a good advocacy chair if you don't have one? So the chair should be an ambassador or willing to become one. It's fantastic to be able to receive those updates. They don't have to jump on every single ambassador call, but it's good for them to be able to receive those updates, be able to watch the recordings of the calls when they can, and get those detailed emails that our ambassadors get. So I think what we found is the best place to start, kind of back to the team effort, it'd be utilizing all staff, so executive director, communication director, the mission integration managers, the advocacy staff, to really look at good people who have volunteered with the Arthritis Foundation previously, to try to find key volunteers that would be willing, have an interest in advocacy to be a part of an advocacy committee on a state level. So this will try to help you find good, reliable people. Just to start is looking at ambassadors. So your advocacy staff can help pull a list of ambassadors in your state. That's a fantastic place to start. Look at the Arthritis Introspective pool. If for those that don't know, Arthritis Introspective to support groups all across the nation. So fantastic people that have a big connection to the Arthritis Foundation. Look at people who've helped at events. But try to avoid the people that are chairing the event. So don't look at your walk chair, but look at people that have sat on a walk committee or have participated in some other capacity at that event. Don't want to overburden any of our fantastic volunteers, but looking for people that may have volunteered previously and want to continue to be engaged and continue to find those ways to cultivate that relationship. The advocacy committee could be a good place to do that. And well-rounded people. Find some people that are enthusiastic, but then also find some people that are cool-headed, inclined. Find some people that are very, very knowledgeable about advocacy, government affairs, and may have, pretty lifetime serving that capacity. And then find people that this may be brand new to them. And then kind of go back onto that realm, look at people that may have connections within your community to elected officials. That could serve a fantastic purpose later on. That's it for my segment, but Ben later on will talk about the next steps in the actual development and creation of an advocacy committee. So I know that this probably got maybe some of those questions popping up or thinking about that, but this will be the end of that conversation.
Thank you, Stan. That was a great overview on our advocacy chairs, how they interact with our local leadership boards, and just thinking through, where we can find some amazing advocacy committee members. So what I wanted to do was talk through a little bit on best practices and different expectations with our advocacy committees. As we know, these committees are volunteer-driven, and we think about all the amazing accomplishments that we've had over the past several years. It's really because of our advocates and our volunteers we've been able to have so many state legislative wins and other accomplishments. As Stephen had already mentioned, it's definitely a collaboration between the advocacy chairs, the advocacy team, as well as your local team members. When you're looking at an advocacy committee, you really want to look at meeting, between 2 to 4 times per year, but with discussion happening, via email if there's some more time-sensitive issues. We really look at an average size committee between 8 and 12 members, and to really kind of to keep an accurate account of what happens in those meetings, we look to have, minutes and being able to share those minutes with your advocacy team members. That in any of our states are some of you multiple markets and multiple leadership boards, but we definitely need to have coordination with all of the local leadership boards so that we have one state advocacy committee. This ensures that there is, collaboration and that there is just distinct working, especially when we're looking at specific state-related issues. Steve had mentioned the ambassador program. And as he had mentioned, there are, briefings on, with the ambassador program. And it's really that way to get a pulse of what is happening nationally and be able then to share that information with all of your advocacy members. To look for chairs, if you haven't already, to become ambassadors. Several of our chairs are actually some of our platinum ambassadors, which is the highest level. So thank you for that. And this is just a really good way to, get this information out to all of our different advocacy committee members. About, goals of the committee, and that is definitely collaboration between the advocacy chair, advocacy team, all of the market staff. And we recognize that everyone on the call today, you're in different levels. Some of you have just chairs in your state, and then some of you have full-fledged committees, so that everyone is at a different spot with our state advocacy committees. Now with some basic, actually, if you go back to the basic expectations, we already talked about how people can become an advocate or an ambassador. It's really important that they get those action alerts. And make sure that yourself as a chair, that you are responding to those action alerts, that you are encouraging all committee members as well as sharing the alert. As an example with this action alert, just this week we all know what is going on in Washington, D.C. had sent an action alert really requesting that all of our advocates, reach out to their senators and, take action on the health care bill. So that's one type of action alert that goes out that's more of the federal level. Really at the state level, whenever we have a state issue, a state legislative bill that comes out, depending on where it's at in the process, we will send out action alerts. We want to make sure that you see them and that you're taking action and that you're sharing and really encouraging others to do this. Not just advocacy members, also anyone in your networks or your contacts. If at any point you're having technical issues, maybe you're not getting our emails, we do work through a database called Aristotle. On the advocacy side, we have over 150,000 advocates, so sometimes things do happen where some of our advocates aren't receiving. Make sure that you let us know. You can contact Julie. You can contact any of us. We make sure that you are getting those. So not, make sure you let us know, and we'll definitely investigate it because those are some really important pieces of communication that go to all of you. This is helping to recruit and engage new advocates and ambassadors. We look at your networks as potential volunteer advocates. As Stephen mentioned a little bit in looking at committee members, we also look to have advocates that you can get at our various Arthritis Foundation events. I know all of you are well aware of Jill Bell Run and Walk. Our Walk to Cure Arthritis. There's other mission-related events, juvenile arthritis events. All of these different programs and activities are fantastic ways to engage potential new advocates and get them involved with our program. Stephen had mentioned the advocacy report earlier, and we ask that you relay that information out to your board. And if you ever at a leadership board meeting and a question comes up and maybe you don't know how to answer, the local staff might not know how to answer, please be sure to take that question and we will definitely follow up. I know there were some questions before at leadership board meetings, and some of us were invited, to participate in their board meeting, whether it be through webinar or through Zoom conference call. One of those, so just make sure you know that is an option. On to Beyond the Basics, some additional advocacy tasks to talk about. As advocacy chairs and for your committee members, that you receive the right training and that you are well versed in our different position statements and all the different aspects of advocacy. So as we have tonight, we have an advocacy chair training. This is one piece of our overall training that we want to do for all of you. later this year into next year, we want to expand this and be able to offer a training for your advocacy committee. Recognize everyone's at different places. Some of you, again, might just be the chair. Some of you might have full-fledged committees. Want to be able to work with you and provide that training. Yeah, and those ambassador calls that we've talked about before, those are amazing sets of training. We will have special guests on, and we'll really talk through issues and really what's happening then and there that you all can be a part of. Connect ambassadors to those local activities and different fundraising events, just really being that well-rounded, advocate and volunteer for the foundation. I did want to make sure that you're aware tomorrow, because we love being able to offer these different webinars. Lee Eller will be working with a couple of our, one of our ambassadors and one of our junior ambassadors, and they're having a juvenile arthritis and advocacy webinar tomorrow. It starts at 6 p.m. Eastern Time. I don't know if anyone would be able to put that link, but we would love to have more of you on that so that you can hear about the exciting things that those ambassadors are doing and to talk more about our JA conference and just get you that information. We also look at you guys to help us with monitoring state legislation. We certainly let our state advocacy committees hear if, your state is a target for one of our issues, whether it be step therapy or whether it be prior authorization, any of these access to care issues. But we also are aware that you all might have your own resources and that you are available to, you might see in the paper or you might be hearing that, oh, this is another issue that might be of interest to the Arthritis Foundation. So if you're seeing, anything of interest that come up in your particular state, make sure that your local team or your advocacy liaison know about it. We really want to make sure that we are out there and really being active on issues that are important to you. All of social media and advocacy is no different. So your entire advocacy team, we're all on social media, tweeting out what's going on in the states, what's going on federally. This is a great way. We've seen success in many of our states when you are able to tweet out or have Facebook messages out to your legislators, to your advocates, encouraging someone to be supportive of a particular bill, or in the legislators, they love thank yous. So a lot of times we've done thank yous to our legislators through social media. And we will help provide you with sample tweets and additional information so that you can share on your social media networks. And I know that the Ambassador Program has social media as one of your tasks for. So many of you have already done social media efforts. Participate in legislative process. Many of you have testified at hearings. You have met with your legislators. And that is why we've been so successful. And this year we've had 14 state victories, is because our volunteers are out there at the state capitol, out there meeting in district, and really working with legislators. So as state advocacy chair, we'll work with you and let you know, well, what's happening in this state and how can I be involved? Lastly, I want to make sure that you all are familiar with our arthritis outcome tools. We do talk a lot about our different patient access issues. We want to make sure that you're aware of our position statements and our Arthritis Foundation website. One of our team members, Claudia, will be sharing a little bit more about our website. Hi there, I don't hear any sound.
#6, Claudia. That's the issue.
Hear me now?
Claudia.
Okay. Hi. Appreciate your taking the time to join us tonight and in our webinar training for advocacy chairs and the staff. So we're providing you some resources and tools that we have on our website, but also necessarily on our website. And in fact, with the next slide, you'll see that we have fairly tool that's available through your advocacy director. If you can, that called the State Legislator's Introduction to Arthritis. And the not about this tool is that we can customize it for you to use. You visit with your state legislator, and we actually did a pilot with this at our National Advocacy Summit in D.C. in March, and it went very well. So it's customized by actually having your advocacy state director's name and contact information on it. But only a few pages, and I'll send this to you, or whoever your director is would send it to you, and you could take it just later when you meet with them, either in their district office or at the state capitol. But it basically offers you several things to let them know about what the Arthritis Foundation is doing and what we're about. It is, Ann Palmer does have a letter in there, and of course our CEO, what the Arthritis Foundation is doing, and more details about arthritis. We have a U.S. map, which is by each state with the percentage of the population with arthritis. Always beneficial when you're talking with your legislator. They usually want to know that. And then it also includes legislative position statements, for instance, step therapy, biosimilars, prior authorization. And then it also can help people in your state, the legislator, know what we have, our tools and resources that are available on our website. So it's a great tool to share with them. It's something to hand them in person when you visit and leave behind. So next slide, please. The website are many tools and sources again, but this particular, when you go to our website, it gives you information pretty much A to Z of everything you'd want to know about what's going on with the states, with your on a full level, how to be an ambassador, what results that we have so far as a foundation, what we've done in advocacy, and also some of the current news and regulatory letters that we have sent federal level to Congress. So, for instance, if you look at the tabs on the left, and it's a variation of many things, but if you look at, for instance, the advocate tools and resources, with the third bullet down, you can find, when you click there, an advocacy toolkit that gives you everything you need to know about being an advocate. We're recruiting and talking to people and getting them to get involved. This is a great tool to guide them to. And same thing for the ambassador program, although earlier the legislative position statement there as well. And the important part of that is that when you're talking to legislators or talking to advocates, many of these topics are issues that people living with arthritis or caregivers have experienced, such as the step therapy or the having trouble getting prior authorizations through, out-of-pocket expenses type of thing. So that's where you're going to find all of our positions. Go down as another example to the news and regulatory letters. They're most important, especially now in our current environment, but when you come at, you're going to see all that we have done so far in making our voices heard to Congress, how the Arthritis Foundation feels about a particular subject, why we feel that way, why we're advocating for people living with arthritis. So important to know what's currently going on and where we stand on that. And then go to the next slide. The position of the advocacy webpage, but you will see, again, listed some important links where you can find more information. For instance, our National Advocacy Summit, if you wanted to get details about that, this is the one that we just had this year in March in D.C. And then if you look to the left, the top picture, the Affordable Health Care Act, what you need to know, great link to give you more information about, you know, why this is important, what you need to know, what you can do. And so that just is a very excellent resource. And below that, this is, again, something fairly new for us, but the prescriptions for access. When you click there, you're talking to people and they have issues and you were trying to recruit advocates. Sometimes people ask, well, where do I go to get more information about how to appeal a denied claim, or my insurance doesn't cover a particular medication or whatever. This is a great tool to give you more details about exactly what to do and the steps to take. So it's really important to understand what's available there so you can share that, again, with your new advocates and other advocates that you talk with. And you can next page, and again, it's the list of the actual website page under advocacy. I know busy and it's hard to really find time, but maybe just taking a few minutes then during your week to just investigate all that's on here, because you get questions from people outside internally as well that you want necessarily have the answers. You can find a lot of it here. You can also, of course, reach out to any of your advocacy directors to help at any time. The next slide, this is probably one of the most important, but when we're trying to recruit new advocates to get them more involved, maybe you've met at an event like a Jingle Bell Run or a walk, and they want to know, well, how can I sign up? Well, obviously, it's an event. It's easy. You can sign up on a piece of paper, but here you just click on sign up to be an advocate on the website, and it's very simple, and it just lets them know that it's not a difficult process to sign up. And slide, and I mentioned earlier about our results and what's available there, such as the statements and well, that was the one above, excuse me, but the different regulatory letters that we have sent. But also you'd like to know what's going on across the country in different states. So this is a map of the country, and if you click on below there, it says click here to see track legislation, you can actually go there and pull up your state to see what's current and what legislation has passed prior. So, for instance, it tells you that a particular bill is passed, or it tells you that a bill was introduced, but yet it died. So this is also good information to know. Nice. We also have our Advocacy Blog that's available on our website. And again, we post any current information here, like any of our state victories, what's been going there, who was involved, advocates and the ambassadors who supported and maybe went and testified. We share their story, and this is just another way to stay current. I'll turn it over to Ben now, and we'll save the questions for later. Thank you.
I'm Ben Chinook. I'm the State Policy Director at the Foundation. I'm based in Massachusetts. Next, I'm going to go over a little bit about the next steps and how to launch your advocacy committee. As Michelle mentioned, we know that the three people are in different stages of this development. Some local leadership boards have advocacy chairs already. Some are looking for the advocacy chair. Some have full committees and some have partial committees. Where you are along the process, you may be in any one of these steps. We're happy to work with you in any case. Step is identifying an advocacy chair. To do that, the best course of action is to discuss options with the market staff, as well as the regional vice president, the executive directors, community engagement directors, as well as the alt member. These people, like Stephen mentioned, about bubbling up advocacy committee members. They could be involved in other parts of the mission process. They could be past walk chairs, JVR chairs. They could have people who are engaged at an advocate level, but not quite ambassadors, and any of those people would be great choices for advocacy chairs. Appointed, the advocacy chair will work with the market staff as well as the alt member to identify committee members. Steve's out earlier in how to bubble up advocacy committee members. Again, you're looking for around 8 to 12, depending on the state and the number of tasks you probably have through the year. That committee is secured. You can go ahead and launch your first meeting. At that first meeting, Michelle kind of went over what your typical tasks will look like. That's for media campaigns, or it could be recruiting ambassadors, could be participate in hearings, a number of different tasks, and you work with your alt member to design that and tailor that to your state and the legislative activity that's going on there on both the state and federal level. I mentioned you could be anywhere along this process right now, but if you need help with that process, please reach out to us. We're happy to work with you to identify potential committee members or some specific tasks going forward.
All right, so we're going to do some basic question and answers that we've been pulling in throughout the briefing. We want to do a couple quick questions. If you are wondering if maybe you're getting alerts or maybe not getting alerts, we want to make sure that you are signed up to be an advocate or signed up to be an ambassador. So there are some easy ways to do this. You can either go into them and sign up now just to cross that off your list, or if you simply email me at jeller@arthritis.org, I can confirm that you're in our database, and then that you would be receiving our email. The next thing we have down here is volunteer chairs have access to Aristotle. Now, Aristotle is a system that our staff have access to and can help you by pulling lists and help you by identifying some key players that you'll be able to coordinate with and chat with so that you can make your advocacy committee the best it can be. But unfortunately, we can't grant you access to the system itself. What that means is that you'll be able to coordinate more closely with your different advocacy leadership team members that help you build that relationship as you look identify different ways to get involved otherwise. Some options we have. I'm seeing some requests for people to make sure that they have access to the webinar tomorrow afternoon or tomorrow evening. And if you mention that to me here, either send me an email or I'll see your chat and I'll shoot you an email with that WebEx information later on today. We're some more questions down here. Can the committee members also share action alerts with others that are not on the committee? Well, absolutely. Action alerts can be shared as broadly as within your own family, to your neighbors, to your friends, to the people you don't know that well but you're friends with accidentally on Facebook. Share action alerts widely, because these are things that really help us get a hold on public policy and build relationships with our members of Congress and elected officials in the state. A hold of our leave behind materials. So this question came in from Kathy Garan, and I'm pretty sure that that is in reference to our Welcome to Congress or our Welcome to State Legislature packets for our state elected officials. I get a hold of those leave behind materials that are specific for your state or specific for an issue that you want to talk about by simply emailing one of your specific advocacy leadership team member, and be able to pop that with their contact information and with different resources that you can use for your specific meeting. We have a question here that is, will there be a means for the various advocacy chairs to meet and collaborate with each other? Now, this is a question that I think brings a larger conversation to mind. It'll have to be something that we work towards together, but one of our ultimate goals is to have an advocacy chair in each of our markets or each of our states that was able to provide different model information for other advocacy chairs to collect multiple different plan action and successes, things that have maybe not been so successful, so that we can kind of have this consciousness among our advocacy chairs. So part of that will be collecting database on our part, and then also coordinating with each of you to learn more about how you want to communicate with each other and what types of systems that should be in place. If you have any ideas for what you want to do, whether that might be a Google Doc that collects all of this information or an email list, please send an email to me, and I will coordinate with our team to collect the best ideas and put them together into an action plan that works for all of you.
Julie, this is Michelle. I had one other thing to add to that piece. Yeah, I know one of the questions, too, was about the survey link, and that survey link was in the reminder email today, and we can certainly make sure to send out another reminder about it. But within the survey, we really want to hear from you, exactly what Dr. Gawanter asked. So please make sure you respond to that about what you really are looking for, whether it be, those opportunities to chat and learn from each other, whether it be, looking at bringing in to your state advocacy meetings special guests, or having more information about, our position statements. So I really do want your feedback, and exactly what you said, Julie, that information will help us as we move forward. But make sure that after this webinar that you do complete that survey so we can start gathering that information.
Yeah, thank you so much, Michelle. That was exactly what we were working toward over here. I appreciate that survey reminder. We have a couple other questions here. One question is, can committee members contact other advocates with upcoming events or local announcements? I think that every opportunity you have to connect your advocates with a local event or something happening in your state, that's a great way to continue to build your relationship with your advocates. So absolutely yes, please can make those connections and share that information.
And not just with advocates, but with anyone in your network that you think might be interested.
Yeah, widely we share that, the more likely we are to recruit new members to our grassroots network, which is our ultimate goals here in advocacy and access. Another question we have is, will the ALT team be sending out periodic updates of new advocates and or ambassadors to the local staff for follow-up? Please clarify if it will be one and not the other. And another question, could we get a current list of advocates and ambassadors on a local level? So this is a sensitive question only because our advocates really are careful about how widely we share our email and phone number information. encourages you in as responsible as possible. So that'll flow through your advocacy leadership team member.
So we're happy to share lists of names, and I would just reach out to your advocacy leadership team member for those names. In terms of making contact, we do want to facilitate peer contact, so to speak. So we'll just work directly with your advocacy leadership team member and other staff in the local market to find a way to make that happen.
Absolutely. That speaks to our next question, which is about contact info. So just always defer to your advocacy leadership team member to facilitate that type of communication. And with that, I think that brings us to the end of our list of type questions. We'll leave open for 1 or 2 more minutes just in case anybody has a few other questions that they might like to ask. It's time. I'd like to ask our advocacy leadership team members who are on the line if they have any last-minute reminders that they want to hop on and share with us.
I don't really have a lot more to add. I just wanted to say thank you to all of you for being on the phone. We're really excited to work with all of you. We continue to develop our committees, and I think this is just going to help us even have more of a presence in the state.
New question in about metrics and how to communicate to boards about quarterly metrics. I think if you want the most current, so we do our metrics in advocacy monthly, and if you want the most current numbers for your markets or your state, the best thing to do is really just to email Julie and ask her for the most current, because she sort of aggregates all of that and sends it out to some of the regional vice presidents and others. So she would be the best person for the most up-to-date information, and I know that she would be happy to share that with you anytime.
Absolutely. While we're answering that, we had one more question come in. I know that the Arthritis Foundation and the American College of Rheumatology work together on a national level. Is there a similar way of collaborating with state medical organizations at a state level?
Yeah. Julie, this is Michelle. I can
go ahead. I was just going to talk about Michelle. Go right ahead.
Perfect.
Okay, not a problem. We actually do work with ACR as well as CSRO on the state level. Many times, they're the first providers that we will look at to see if there's a state site, especially when we're looking at having specific issues in a particular state. So we definitely, we want to on strengthening those relationships. And Dr. Gore, I know you've been working with us too, so it's been great being able to work with with the state medical organizations, and we really want to continue to do that, not just on some of those real specific coalition issues, but anytime we can have collaboration with them, we certainly want to do that.
And on the national level, we've been working to cultivate close relationships with other providers as well, and I know some of our advocacy leadership team members have as well, and that's something that's really a goal, not just within the advocacy team, but with others that we're working more closely with in the home office, orthopedic surgeons, dermatologists, physical therapists, nurses, office managers, and, the organizations, and then, the people within those organizations as well. So that'll continue to be a focus, and I think you'll see a lot more there.
And this in West, I just wanted to give an example as far as collaborating with the state rheumatology societies or alliances. I would say in California and as well as in Ohio, we in the past have had lobby days, similar versions of the Advocacy Summit in D.C., but on a state level. We've done those jointly together with the rheumatology societies in the state. And so it's just one example of how we've worked collaboratively together.
Questions before we wrap up today? All right, thank you all very much for your time. As I said at the beginning of the call, we are always open for other questions. Please fill out the survey because it would be really helpful as we do this in the future to know what you want to hear more or less about. And we look forward to working with you all in the future. Thank you so much for your time.